Hey guys, Dr. Augmentation at Apres. Wanted to talk about one of the most valuable things that we have here when it comes to breast augmentation consultations. So we use a system called Crisalix, which is a 3D imaging software. We take photos of the patient beforehand and we can upload those photos and use those in this 3D imaging system to show the patient what different implants are actually going to look like on their bodies. In my experience, I've never really loved the practice of having them try on implants because I don't think it's really accurate. Patients aren't wearing the same bra size that they're going to wear post-op, and it doesn't give them a real idea of how things are going to look. This allows us to show them much more accurately how things are going to look, and we can even show them how it's going to look in clothing, bathing suits, etc. But what we do with this imaging, the first thing is we're able to analyze what the volume difference may be from one size to another, because pretty much all women have a little bit of asymmetry in one versus the other breast. And this allows us to see how much that is, so that if we want to pick two different size implants, we know exactly which sizes to pick rather than just trying to eyeball it and guess. The other thing that's incredibly important is when you're trying to determine, well, what's the right implant size for me, probably the most critical measurement is the diameter of the breast, which you can see here. We need to select an implant that's going to fill that diameter out appropriately. Then from that starting point, depending on how much fullness or projection a patient wants, that guides us towards whether we're going to use a moderate implant or a moderate plus or a high profile implant. So that's basically the sequence of how we come to the decision of what's the right implant for you. This is really important because a lot of times patients may look at before and afters, or they may talk to their girlfriends who have a certain size, and that size is going to look completely different on them if their dimensions and breast diameter are different. So that's why you really need to use the measurements to figure out what's going to be the right size to achieve the desired look that the patient wants. The other thing that this is really helpful for is once we've chosen implants, so let's just kind of, randomly take a look at something and say, somebody wants to be kind of full C, for example. And what this will allow us to do, the most valuable thing, is a lot of times patients are between sizes. This will allow us to compare, and we can pull up 3 views and show them, okay, well, here's where I think you want to be. We're going to start with this. And then if they say, hey, can I look at what a little bit smaller or a little bit bigger looks like? The ability to look at those things side by side can often help them realize that, oh, this isn't that big of a difference, and I feel comfortable going with this, or I like the way this other option looks better. So it's really empowering for the patient. They play a role in making that ultimate decision, and it isn't any longer just me picking based on what I think the patient wants. So I think this has been really helpful. It dramatically reduces reoperations for size changes, because patients really have a better understanding of what it is that they're going to get, and they get to play an integral role in that